is sleep hygiene? Sleep hygiene is very commonly talked about these days. It's not a treatment for insomnia, believe it or not. So while it's helpful, it's not sufficient to treat insomnia. You need to know that sleep hygiene issues are being addressed at some point. People need to rule out any sort of obvious sleep hygiene issues, but that's correcting a sleep hygiene issue isn't going to necessarily correct insomnia, for example. So there's sleep hygiene that actually takes place all throughout the day. So in the morning, wake up at the same time every morning. And it's also important to have some sort of bright light that's being absorbed into your retina. So some in your peripheral vision. Doesn't have to be direct. You shouldn't be staring directly at bright light, but waking up to bright light is actually very effective. Huberman Lab talks about this one a lot. During the day, limiting naps, at least not napping after 2 p.m., limiting caffeine use, exercising actually improves sleep throughout the night, getting natural light, so working in a windowed environment, reducing alcohol and nicotine use that is actually well known to disrupt sleep, and I talk about this in my channel. You shouldn't have any caffeine after, I would say, noon, but some people push that depending on their adenosine receptor sensitivity. You shouldn't have any caffeine past noon. The half-life of caffeine can vary a lot, but it's generally on average about 6 hours. So every 6 hours, the amount of caffeine in your bloodstream is reduced by half. So if you have caffeine around 10 or 11 a.m., there's actually still a decent amount that's still present by bedtime. And then don't spend any time in bed doing non-sleep related activities. So you shouldn't be working on your laptop in bed. I mean, it's okay if you do that if you don't have any sleep issues, but if you have sleep issues, then I would suggest that you make these changes. Before bedtime, you should wind down about 30 minutes before bed. Don't be doing something that's going to be pretty mentally draining or emotionally charging 30 minutes before bedtime. Avoid heavy or rich foods, which can worsen acid reflux, and that's going to wake you up potentially. Or you can have hypopnic events, which is events that wake you up, but you actually don't realize they're waking you up, and you wake up drained and fatigued, but you feel like you slept the whole night, but you actually didn't. And eating a lot of foods before bedtime can worsen that. In the evening, the corollary to getting bright light is having nice dim light, having the least amount that you need, and it should be of a yellow hue, not a blue hue. Because you shouldn't be absorbing any sort of blue hue, you should really unplug from electronics at least 30 minutes to 60 minutes before sleep. And then doing relaxing activities in the evening, meditation, warm showers, reading a book, etc. And then while you're actually sleeping overnight, the best thing to do, go to bed at the same time every night, drown out any sort of noise. You could use earplugs or a white noise machine. Setting the ambient temperature of the room to be a cool temperature. Your body needs to lower its core temperature during sleep, so you want to help your body get moving in that direction. You also want to make sure that the light is totally blocked out in the room. And you can use eye mask or you can use blackout curtains, but any little bit really helps. You don't want to have any sort of ambient light in the room. You could use some scented calming scents like lavender. There's no good data for that, but it could potentially help. So I hope all of these tips really help with sleep hygiene.